This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor. Sometimes we do these shorter versions of our podcast that we've referred to them as Consult With Me. So we look at specific complaints that people may have, diagnoses they may have. But I want to talk about something else, which is just frustrating as a physician. So
you're consulting with me.
I want to. Yeah, I'm consulting with you. I want to bitch and moan a little bit.
Okay. Have at it.
There are things that become known or thought of or believed in our community, both medical community and our just society, that are completely wrong. They're false. They have been promoted as a truth and have ultimately been shown not to be. Or at least more questions placed about any of these things that alter the way a patient wants to receive any advice that a physician gives or take any therapy. And one of these is the use of statins. Now, statins are designed to decrease cholesterol in the blood and seem to, or definitely will positively affect the health of most people, the vast majority of people, so that their cardiovascular health is better. And they're less likely to have a heart attack, or they're more likely to survive it, or they are less likely to
have a stroke.
They're less likely to have another heart attack. Really, really well accepted by cardiologists, almost universally. But patients I see so often, when I talk to them about cholesterol and maybe recommend that they see their primary care physician or their internist to start on a statin, the phrase that I hear from them, no, I don't want to go on a statin. Or it could be, let's say, osteoporosis, something that's just really not given as much significance of these weak bones as we get older, that can not only weak bones as we get older, but they're more likely to fracture. And you fracture, you're going to age much quicker because it's incapacitating. And so people don't want to take the medications because there are some known side effects that are very, very infrequent, but well known. And so I see patients that are refusing to take well-recognized, solid, evidence-based therapy, and for some minimal reason, just refuse to take it because of what they've heard about the possibilities. And with osteoporosis medications, a story an experience I had on one occasion was looking at a patient a number of years ago, had really bad osteoporosis, was at a very, very high risk of fracture as she was older. And the one of the early medications for osteoporosis was recommended to her. But we also knew that occasionally, very occasionally, that patients that took that medication would have a problem with their mandible, the jawbone.
Right.
And so in talking to this patient saying, you really need to take this medication for your bones because you're really at risk at having a fracture and dying much more quickly, or having a much more incapacitated life, because she'd recently had some dental work that she'd spent a lot of money on. And she said, no, I'm not going to take that medication because it might damage my jaw. I mean, totally illogical thinking here. And, cholesterol and hormones, people are very concerned about taking cholesterol in their diet. We need cholesterol in our diet. cholesterol is a basis for pretty much all of our hormones, and we need it in our diet. So taking cholesterol actually doesn't increase the bad cholesterol in your blood. It doesn't make you more likely to get a heart attack, but you need that for other things to work in your body. And it's just, people have these sudden ideas. No, I'm not going to take statins. I'm not going to take Fosamax. I'm going to eat. I'm not going to have egg yolks anymore and any animal fat. It's very frustrating as a physician when that illogical thinking comes in, and patients they've read something about
because people
side effects.
The side
or they talk
effects,
about it,
are
and
scary, and I think we're opposites in that way. Like I think probably can relate more to the patient that you're talking
that
about.
I'm really frustrated with.
Because I will have to really look at it and weigh it before I take a medication. And you're very quick to take a medication.
That's
because you're a doctor.
I believe in the science. Okay,
Yes.
I'm very well aware of complications of things, but we just deal with it logically.
It's because you're educated in a way that your patients are not.
Yeah, but I'd really like them to listen to me sometimes.
Yeah, I know.
Anyway, that's my pet peeve today.
Yeah, and I know I don't listen to you enough either.
That's true, for sure.
Yeah. Thanks for listening. And if you have more questions, please let us know, either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.